Hello, I'm David James. I'm a paediatric emergency medicine consultant in Southampton and the emergency care lead for Healthier Together. Today we're going to talk about fever and the remote assessment of children with a fever using the Healthier Together tool. To find this, you'll find it in the Professionals tab, then GP and Primary Care, Clinical Pathways, and Clinical Pathways Remote Assessment, taking you to a list of pathways you'll see here. These are suitable for people working in primary care, such as GPs or advanced clinical practitioners, or for those working as practitioners through the 111 service. As you'll see, the website we're going to look at today is the pathway for fever. This is the fever pathway, set out in red, amber, green, as per every other Healthy Together pathway. Fever we take to be a temperature greater than 38. All those younger than 3 months who have fever should be sent to hospital, with one small caveat. If they have had their vaccinations within the last 48 hours and are otherwise well, feeding and handling well, then they could be left in the community and safety netted appropriately. However, all others should come to hospital. If you're familiar with our pathways, you'll notice the usual descriptions down the left-hand side: colour and activity, respiratory, circulation, hydration, and some other factors. And you'll also notice that the red actions are immediate referral to emergency care, either by 999 or by the parents coming themselves, whilst the amber actions are further face-to-face review, either in person or on video. Let's go through some of the pertinent points in the assessment. Things to ask about for colour and activity. What is the colour of the patient? What are they like? Are they very sleepy? If asleep, can you wake them up? And if you can't wake them up, then they should come to hospital. Or if woken up, if they don't stay awake, likewise. If they're not that bad, but they're still not themselves, they need a little bit of stimulation to wake them up, they are just not acting as they would do normally, perhaps they're pale, please arrange for further review. You'll see in the respiratory section a range of respiratory rates. It may be possible for the family to count their respiratory rate for you on the phone, or it may be possible for you to watch this on video, and you'll see some ranges there and what to do with it. If the child in the context of fever has some extra work of breathing, but not severe, they're amber. However, if either you can see on video or is described to you severe respiratory distress, sucking in between and below the ribs, or perhaps a tracheal tug, which the parents might describe as an indentation above their sternum, they should come to hospital. Circulation, a child with reduced urine output who may be not tolerating fluids, or one with the cold hands and feet in the absence of fever needs a further primary care review. And finally, other factors that would suggest they should come to hospital would be a seizure, rigors, or non-blanching rash. And you'll see a long list in the centre of factors that make you think about a specific bacterial diagnosis. If you're thinking that, they should see a clinician. Also, 3 to 6 month olds with temperatures greater than 39, as per NICE, should be seen, as should anybody in whom you are particularly concerned the parents need additional support. If there are no red or amber features, please proceed to giving them either the under 5 or over 5 safety netting advice sheet, hyperlinked here on the Healthier Together website. This contains another red, amber, green traffic light system for the parents this time, and additional information on how to assess and manage fever at the bottom. Please send this to the family using the SMS share function at the top here, inserting their phone number into this box and pressing share. Thank you for joining us. We look forward to seeing you on Healthier Together soon.